when it comes to ketamine, is this for people with mild depression, like severe PTSD? Can somebody maybe that has like mild depression try it? Because I had this one listener, she was going through a very bad postpartum depression, and all basically she was getting is just she was being put on different pills and trying to figure out what dosage are working. As it was like 2 or 3 years of this postpartum depression, and she like still can't figure it out. And she even reached out to me. This was maybe like 8 months ago, maybe like a year ago, on my recommendation of like what she could use, because she listens to one of our podcasts and we talk about psychedelics and all that kind of stuff. So she was reaching out to us and asking like, hey, do you recommend like ketamine? Do you recommend certain infusions? So who is ketamine specifically for? Is it people that have really stubborn depression where they just can't get rid of it with meds, or is it for people that are just maybe going through a little bit of hardship, they could try and go through it and feel better? Who is it specifically for?
Yeah, that makes me sad to hear about that listener. Yeah, this is amazing for postpartum depression. And too many pregnant women also suffer from depression while they're pregnant, and they can't really take SSRIs because of the risk to the unborn child, and they suffer. And then there's concerns after they give birth about transference through the breast milk. And a mother who's disengaged from her newborn is just really terrible for the mother and the child, for, the other partner, the father. I mean, everyone involved. It can be really, really bad long-term effects. So ketamine works quickly, safely. It does not, there is no proof that it would cause harm to the child. It's unknown. Those studies are very complicated to try to do, right? For obvious reasons. But SSRIs are proven to cause problems. Ketamine, it's kind of unknown, but the half-life is so short and it has such a different mechanism of action. There's a lot of good basis for using ketamine, if not during pregnancy, then at least for postpartum, no question. There's been some interesting studies on ketamine for postpartum depression specifically that have shown really, really positive results. So I would definitely advise any woman who's going through that to try ketamine, and of course needs to consult with a physician and review her specific situation. But suffering for years like that just doesn't make any sense at all. It's really good for various types of other forms of depression, bipolar depression, unipolar, could be minimal to moderate, could be severe. Doesn't have to be really bad cases for people to benefit. PTSD, anxiety, OCD, suicidal thinking, among others. A lot of people hear about it and think of it as a radical treatment, and that it's only for people who are really in a bad way and they're not bad enough yet, and maybe they'll wait and see. I really want to discourage that kind of thinking. We have a solution that works 83% of the time with none of the side effects in a matter of hours to days. It's available now. If you're suffering, don't suffer anymore, period. If you have a clinical diagnosis, you're a candidate. There's almost no exclusion criteria. We don't see schizophrenic patients. We don't see some types of personality disorders. We don't see people who are actively manic or actively psychotic. Pretty much everyone else is welcome. And you don't have to have a long history of suffering or be super severe in order to benefit. Most of our patients are of the treatment-resistant category, in the sense that they've tried and not benefited from at least 2 or more conventional treatments before they come to us. But that's not necessarily something that people should have to go through.
And said, what about like ADHD or even like epileptic disorders? Is there any research done on effects of ketamine on those people, or is it majority focused on like depressive issues?
I don't know. I've never heard of anything with epileptic disorders. With ADHD, I think it would help. I'm not aware of much research there. But I've talked with some people who have tried it in other contexts, more outside of a clinical setting, and said it helped with their ADHD. That's very, very anecdotal, right? But it really helps to quiet the default mode network ketamine helps to quiet the chatter and the noise in the mind. It helps to kind of make people more centered, more connected to themselves. It enhances neuroplasticity and brain function in the ways that we've already talked about. So if ADHD is related to neurons kind of firing and wiring together in ways that aren't conducive to your focus and your ability to get things done that you need to, if it's a result of agitation or even trauma from the past, and this is a trauma response, I don't know. Obviously, everyone's different. ADHD is complex. I don't pretend to be an expert on that particular condition. But if some of these things are a part of the picture, then it would make sense that ketamine would help with it. That being said, again, I'm not really aware of much research having been done in that area, but it would be interesting to see for sure. I can tell you that we've had autistic patients who came in for issues with mood, but actually found that their function and their autism was improved by it, in the sense that not only their mood, but they were able to socialize and verbalize better and had better self-control. We've had patients with a traumatic brain injury, TBI, who came in, again, not to treat the TBI, but for their depression or their PTSD that was related to that. And a added benefit was actually better cognitive function, better memory, and some of the symptoms specifically of the TBI that were improved upon. So there's a lot of really interesting stuff to be said. And I think, for some people listening, and other critics might say, oh, like they're just saying it works for everything, The reality is so many of these conditions are related to the same processes in the brain. I really think we're moving in a direction where we're starting to recognize them more as symptoms of the same thing and not just individual separate illnesses, because a lot of this stuff stems from trauma. And trauma can be what a lot of us think about when we think of it as far as violence, guns, war, assault, etc. But trauma can manifest in many, many other ways for many people. I would say probably most people have experienced at least some type of trauma, and it's often something in childhood. And that can manifest itself in different ways with different symptoms. And some symptoms, I think, sometimes are called like their own separate thing, but really they're just a result of that, right? So it does make sense that ketamine can help with so many different mood disorders if this kind of understanding of what this is all about is true. And if it's really enhancing brain function and it's really helping to create new neural pathways and helping to disrupt negative ways of being and thinking, how could that not help all of these different types of challenges that people are having? And it does. And it's clinically proven for many of them. And we see it firsthand. We've done 25,000 infusions in a decade, been open since 2014. We're one of the first clinics in the country. And also there's about 170 studies that have been done, around 80 of them completed with results published by leading institutions. So it's really important that listeners understand this is not just some interesting possibility. I mean, this is proven through it, like I said, a decade of our experience being dedicated to it, and also a substantial body of scientific literature by all of the leading institutions, USC, UCLA, Johns Hopkins, Yale, Stanford, Harvard, National Institute of Mental Health, Cleveland Clinic. I mean, the list goes on and on and on.
Is it because ketamine is more of a drug that it's almost to me like it produces more of like a systemic effect than like a real specific one, like for certain SSRIs where they just affect serotonin reuptake or they block that pathway, so there's more serotonin flooding. To me, it seems like ketamine has more of like a systemic unknown effect in a way. Is that have any validity?
Yeah, I mean, I think, SSRIs are kind of a Band-Aid over a gaping wound, and they're treating symptoms. And ketamine is really getting at the source of the issue. Ketamine is cleaning it out and suturing it closed and putting proper wound care on it. It's just a night and day difference, I think, in what's going on again in the processes in the brain, and also the personal experience that can be really profound. So yeah, it's not really apples to apples for
Yeah.
sure.
Yeah.
Yeah.